if we can all agree, we will start, and then whoever joins in will find us where they'll find us in the journey. Yes,
All right.
so welcome everybody. My name is Dr. Linda Nyamuse, for those who don't know me. I am the founder of the Mental Sphere, which is an online platform for creating awareness on mental health. And we've been doing a series of webinars. This is series number 3 out of 3, and then we take a break for the next 2 weeks and resume 3 more webinars. So this week, as you know, we are talking about suicide. And suicide is a very delicate topic, especially within our community. So we are going to have 1 hour. Hopefully, we'll not be. But anyway, if it pushes past that, maybe not too long after. So 1 hour of engagement for this discussion. So just some rules of engagement. This is a safe space for everybody. So if you want to share a story, feel free to share whatever you're comfortable with. Do not share something that you feel you may not want, you're not too comfortable. Don't feel, what is the word? Compelled to share something that you're not comfortable to. So we'll avoid, I mean, language. Your language is very important. The kind of language that you use. Avoid stigmatizing language, and we'll also learn what kind of language we term as stigma when we are talking about suicide. Yes, and then respect people's opinions. Facts are different, but opinions are respect people's opinions and correct without belittling someone or without bullying people. Yes, because we want to make this as a safe space as possible. So at any point when the speakers are talking and you feel like you have a question and you may forget it, feel free to drop it in the chat box. If you're a bit shy and you don't know, you feel a bit embarrassed maybe to ask a question, feel free to message me directly. I will ask it for you. Sawa sawa. So we will start. Suicide, as we said, we're talking about suicide. This is a World Suicide Awareness Prevention Day tomorrow. The week as well begins tomorrow. And so what other topic do we have to do other than suicide? So allow me to introduce my panelists. Three very intelligent, very smart, very warm people. So I will begin with Dr. Chitai, Boniface Chitai. Dr. is a consultant psychiatrist at Othaya Hospital, yes, and he's also a mental health advocate and a very strong voice out there in terms of promoting awareness and prevention in the mental health space. Dr. maybe you can tell us a bit more about yourself.
Yeah, thank you, Linda. And I saw you stumbled there on the name of my hospital. It's true. It's been quite a journey of some evolution in the short period. So there is it started off as Moi Kibaki National Teaching and Referral Hospital. Then at some point it's called Othaya National Teaching and Referral Hospital. But at the moment it is part of Kenyatta. So it's called Kenyatta National Hospital Othaya Annex. And it's, it's under KNH. So I'm a consultant there. As you know, it started last year. So I'm the founding psychiatrist in the hospital. Of course, before that, I was at Mathare Hospital, and I've been doing advocacy since 2016. Happy to be in this space, happy to be this webinar. I work with young people also. Rise. Yeah.
Thank you very much, Dr. Asante, for being part of our panel. Next, I'm going to introduce one very lovely young lady. I'll call her young because she's younger than me. So this is a lady with very interesting names, Adhiambo Chelangat, and she's a clinical psychologist at Mathare National Teaching and Referral Hospital, and she's also very active in the mental space in creating awareness. And Aviambo, maybe you can tell us a bit more and tell us the name you want us to address you by.
Hi, everyone. Yes, I am Aviambo Chelangat, or by Ile Jinai Mildred, that's my English name. I am a clinical psychologist at Harare, but my training is in medical psychology from Moi University. Yeah, I love mental health and speaking about it. So yeah, it's a passion. I enjoy doing it, and it's lovely to be here.
Thank you. What's your preferred name?
Whichever is comfortable, whichever you find easy, all are mine. So Aviambo, Chelangat, Chela, it's fine.
Okay. So
Yeah.
Aviambo, I'll call you that.
Yeah.
So asante sana for being part of this panel. Our last but not least panelist, Koi Mushara, Wangoi Mushara. For those of us who joined for the Loving a Person with a Mental Illness webinar, you can recall Wangoi Mushara was part of our panelists, and she gave us great insights as well. So we're really happy to have you on board. Wangoi Mushara is a nurse and also counseling psychologist, and she's also the director of the Nueva Wellness and Treatment Center. Yes, I think I got it right. Maybe you can tell us a bit more about yourself.
Thank you, Daktari, for having me here today. It's an honor to be back. Looking forward for an interactive session. As you said, my name is Wangoi Mushara. Koi is a short form of Wangoi. So depending with where we've met, I'm Koi, Wangoi, or Esther Mushara. As you likely said, I'm a nurse and a counseling psychologist. We have a facility where we treat people with issues to do with addiction and mental health called the Nueva Esperanza Treatment and Wellness Center based in Ruiru. Thank you very much.
All right, asante sana for joining us as well.
I'm glad to see, sorry about that, I'm glad to see Jacob. I closely work with him. Anyway.
Wow,
Thank
great.
you.
Asanteni sana, and of course to all our participants, very, very glad to have you here on board. I mean, this would not be if you were not here. So asanteni sana, feel free to introduce yourself on the chat box and ask any questions as we go by in the chat box. Asante sana. So as I had introduced before, this is the Suicide Awareness and Prevention webinar. So just to start off, what is suicide, and are there types of suicide? What is para-suicide? Someone says, oh, it was a suicidal attempt, it was not a suicide. It was a para-suicide, it was not a suicide. What do all these terms mean? And why don't we use the term committing suicide anymore? Daktari, maybe you can take us through this one.
Okay, thank you, Linda. There are many terms that are associated with the suicidal behavior. So a lot of this you are describing are the suicidal behavior. Of course, suicide itself is the most severe form of suicidal behavior, where somebody performs an act that they know will result in death, and they actually die. So that is suicide. The others are related. So you can have suicidal thoughts, just a person thinking mostly about death and them being involved in their own death. We have deliberate self-harm, where somebody, you have deliberate self-harm, where a person basically would, is everything okay?
Yeah. Sorry, lost one of the panelists. So
sorry. I hope they'll be coming back. So we have deliberate self-harm. In deliberate self-harm, somebody, that has no intention of dying, but they engage in self-injury many times. Or if it's once, it's deliberate self-harm. If repeated, it is para-suicide. So basically, that is how those two come in. Then attempted suicide, of course, is where the person intended to die, but the whole act does not result in death. So basically, suicidal behavior is usually, you can say it's a spectrum of behavior from the mildest, which are just wishes that come and go in an individual, and then it can proceed to having strong ideas about the death and thinking about it and planning and writing a note and attempting. So attempting can either result in death or not. And so that is, those are some of the terminologies that are commonly used in this field. Yeah.
Yeah. Asante sana. So we've learned the difference between suicide and attempted suicide and self-harm. Yeah. So okay, in the same breath, how do you know that someone is suicidal? Like, what kind of things can make you say, okay, fine, this person is suicidal? Maybe from how they talk or from how they behave. How would you tell that they are actually suicidal? Adhiambo?
Different ways, like Daktari has said, when you see someone who is engaging in self-harm behavior, for example, cutting their hands, or they have like cut marks that could be seen. Sometimes they hide, but at times you could see them. Or maybe they're engaging in behavior such as hitting themselves on the wall whenever they get angry, or using cigarette sticks. Yeah, like just to burn themselves. So when you see someone doing things like those, they're already at risk of actually attempting suicide. Yeah, that is the first one. And then when you see them casually talking about death in a manner that is so, like it's just a kawaida thing or a normal thing. When they say things like, don't you think it would be better, like life is better, or rather I'd be better off dead, or they say things like, I feel so hopeless, or life is so meaningless, there is no meaning, I don't feel like I have purpose. When you see someone talk about such things so casually, then you should be very wary and be very cautious. And then when you see them, for example, giving away property, that once they just decide that, you know what, I'm going to give away stuff in my house, or they're giving away their clothes, especially if they've been through a very hard time, then yeah, you also need to be very wary. Then the last one, which is sometimes very hard to notice, is if after a long period of a dip, or they were not really okay, and then suddenly they're just, without even getting any professional help or talking to someone, and then they just get better all of a sudden. It could be that maybe they've made peace with the fact that, you know what, they're going to attempt, or they're going to engage in suicidal behavior. So they're just trying to make the most of the time that they have left. So yeah, you also need to be very cautious and very wary. When you see them collecting things like prescription medication that, yeah, that they're buying, but not with the intention of taking it, but they're just collecting it, you also need to be wary. Or even getting poison, like either the one for farm, the what's the word? The herbicides, or things like Jik detergent, they're just putting it, then yeah, you need to be wary. Yeah.
Mm-hmm. Okay. Daktari, anything to add?
Yeah, I think she has said it all, but of course, this thing about suicidal behavior is that for most people, they will say it, they will write about it on Facebook long before it happens. So I always look at that as the one thing that the public should know, that if somebody talks about their death, then it should be taken seriously. It should be an outright emergency. If someone is talking about death or writing on Facebook a long post about death, that's an emergency.
Okay, and we've mentioned that if someone is talking about death, someone is constantly talking about death or giving statements that could be suggestive that they want to die by suicide, we should be very cautious. How do you know someone is serious? Because sometimes, like if you're in a relationship with some of these people, they'll be like, if you leave me, I will kill myself. And probably sometimes they don't intend to do that. So how do you know that someone is actually serious and they intend to actually do so, and it's not just a manipulative act?
My opinion here is that it's a question of looking at the other probably risk factors in the person's life. So anything that will suggest that they have increased pain, So the issue of pain, the person additionally is suffering from a mental disorder, that have been suffering from a mental disorder for a while. Probably they are in a state of hopelessness because maybe their pain is taking long to cure, or there may be no cure at all, issues like cancer, chronic illnesses. So a person talking like that in the context of chronic pain, and there is lack of hope, and the person probably is beginning to isolate themselves. So these kinds of behavior around it, will really show that they may be very serious about what they're talking about. But also, what Adhiambo says is that if they are making plans, I think for a person who is starting to make plans about, how, if they have children, who will remain with their children and that kind of thing, that is something to watch out for, and it really shows that they are serious. But also for the individual, how can an individual assess themselves to establish whether they may be now be at a point where they need help? So if an individual, you start to making research, about methods of suicide online as an individual, that should be a red flag to oneself.
So that's a very tricky question, because most of the time you may not know, but when it has a definitive plan, like you can see they have already, even they know where the act is going to take place, what time, when you ask them some of those questions, then you may start seeing if somebody has a definitive plan or not. They know the weapon or the thing that they will use to commit suicide. Then some of those issues are the issues that you need to take care of. And of course, if you have lived with somebody and they start behaving indifferently, they are showing behaviors that are not normal, then that is the time to seek professional help.
Okay. And then, so you said sometimes if you ask and they have a plan, how do you go about asking? As in, how do you start? How do you raise that question? And does asking increase the chance that they will actually do it, or give them that idea that, they can go ahead with it? Adhiambo, maybe you can take us on this one.
Okay. When it comes to asking, it's always best when you ask directly, so that you're even showing them that you are comfortable, you're very comfortable to have that conversation with them. Because now when you're not so sure, or you're like trying to walk around eggshells around it, then you might not get the type of answer that you're looking for. So yeah, you can just ask directly that, have you been thinking about attempting suicide, or have you been having thoughts of killing yourself? Just directly. And then you say it in a way that you are ready to listen to them without judging them, and that you're going to be fully present, or even preaching to them or telling them that, which is very common, that what do you think about your family? Why do you want to leave your family or your children behind? That seems so it's a bit judgmental and manipulative. Because someone who has gotten to a point where they want to attempt suicide, or they're thinking of suicide, it means that they feel like it's the only option. So you just ask directly, have you been having thoughts of killing yourself? Then if they tell you yes, then you can now assess for intent, as Koi was saying, that you assess whether they have a plan. So you can ask that, what method would you use, or what have you thought of doing? And also what you're not supposed to ask is when it's like you're asking a leading question or you're expecting a no answer. Like, for example, you're not thinking of killing yourself, are you? Because that already feels so, it's like you've judged them in a way. So you just open-ended question in a non-judgmental way and very calm. Yeah, do not hesitate, because when they get to that, then maybe they may not be too comfortable to open up. So when you ask and then they have a plan, and they already have access to the method or whatever they are going to use, then that is a psychiatric emergency. You need to get them help. So maybe if it's at night, you can sit with them and tell them that you want to help them, and you'd want them to tell you how to help them. Because sometimes you might want to help, but you do not know how or what they need. You could just tell them that I am here. If you want to talk, you can tell me anything. I'm going to be present. I'm going to listen. I will not try to find solutions for you, but I'm just going to be there for you. If you want us to sit in silence, then it's fine. Then when morning comes, you get them professional help. So that could be either be an admission after a mental health practitioner or an expert has assessed them. Yeah.
Okay. Yeah. Okay. Okay. So you mentioned something very interesting. Do not tell them to, probably I'll rephrase it. You're not thinking about your family, you're not thinking about your friends and what you're leaving behind, which is a very common statement that people are usually given whenever they raise such a thought to someone. So is it true that people who are suicidal are selfish?
Well, maybe I could answer. And there's also a question that you had asked that I had not answered. There was a study that was done in the US where teenagers were given a questionnaire just to assess whether they've been having thoughts of suicide or killing themselves. The purpose of the experiment was to see whether talking about suicide would actually lead to people like thinking more about it, or it might actually like increase maybe mental health issues. But actually, it was the opposite, because when it gets to a point when someone is telling you that I've been having thoughts of killing myself, maybe they've never said it before. So once they vocalize it or they say it out loud, it could offer some temporary relief. So the outcome of the study was talking to someone about suicide does not increase the suicidal thoughts or ideation. Actually, it decreases to some extent, but they also need to like get professional help to take care of the underlying issues that are actually leading them to thinking about killing themselves. And I do not think that someone who is suicidal is selfish. I feel like from the literature that I've read or the videos that I've watched, like for them, that seems to be the only option, that they have thought about what they could do to offer them like relief or to take care of the issues that they're going through, and it seems like it's the only option. So I actually think it's a very selfless thing, because it's like they just want to end it all, but I'm not promoting it. I feel like if you get help, that you can get help. Yeah.
Okay, asante sana. Daktari, maybe you have anything to add?
Yeah, I totally agree with what Chelagat has been saying, that it's a question of, in the person's reality, there's a rationale to their action. In the person's reality, their reality is different. Probably at a philosophical level, they also talk about a stage in life where someone looks at their remaining part of life as probably going to be spent in pain, that there'll never be pleasure ahead. So if the judgment of the individual comes to that point, then the rationale is that instead of continuing to live the remaining years in pain, it's rather to end the pain. So that is at a philosophical level of looking at the question of, is it ever rational for someone to consider suicide? And yeah, and at the beginning, of Chelagat's presentation about what to do, people are always overwhelmed about the idea of suicidal behavior. It can be very confusing, even for professionals, but even more so for family members who are not trained with professional mental health skills. So what do? I mean, for the biggest contribution you can make in that individual's life is, one, listen, just listening to the person's thoughts, and making it up to them that anytime you feel like this, just tell me. Number two is also additionally making the environment safe, the safety of the environment. Take away anything that could be poisonous, lock away the firearms, all drugs or drugs that they may be taking, just lock them away in safety and let them be in a safe environment. And the third is what also Adhiambo talked about. So the role of a family member or a close friend should be very understood very clearly. You may not really know the technique of how to go about even the questioning, but your role is more of to listen. So you may not even have the right advice to give, and don't worry about it. Just listen to the person. Yeah.
Okay. Okay. Thank you for that. And just in line with that, if someone calls in the middle of the night and they're like, Daktari, I'm not feeling like this life is mine anymore. I want to, yes. Or you read a message or someone sends you a message on Facebook, either a relative or a friend, and tells you it's the end of the road for me. At that particular time, that moment in time, let's say it's midnight, or what can you do? You are probably not in a position to, given the curfew and everything, you're probably not in a position to approach them at that time. How can you be of help to this person in distress? Yes.
If there's no curfew, hoping that there will be no curfew, and I'm hoping the curfew will end soon, so that such emergencies can be dealt with the right way, because the right way will be for a person to go to their home and stay with them and listen to them and offer them to take them to hospital. That's the right step to take. So now, given the curfew, the options are quite limited. So you could either advise them to find a means to go to any hospital. Every hospital is a mental health facility. So they could go to any hospital. If that is not possible, you could just spend some time on the phone listening to them. That listening to them is the only help that you can be able to give. And at the earliest opportunity, then go to their home or mobilize close friends and relatives, go to their home and see if you can get them some professional help.
Mm-hmm. Adhiambo, anything to add?
Assuming that when they're calling you, it means that they're not like they were not 100%. It's like that 1% needed help, because with people with suicidal behaviors, we have 3 types: those who do not want to leave completely, those who want to leave but now the circumstances that they're going through are making it a bit hard, and those who are very ambivalent, so they're still contemplating. So I'm trying to place this person maybe in the 3rd group, where they're still ambivalent. So when they call you, it's like they're just looking for something to still hold on to. So I'm thinking what I'd ask them is so far, what has been your reason for living, or what is keeping you alive? And then you start with that and then build on that. So when they say, maybe, for example, I do not want to leave my children behind, then you're like, yeah, tell me more about that. Just getting them, encouraging them in a way that it's like you're motivating them, but based on what where they're at that particular moment. And then, that is now that given that you have the curfew and all, so just listening to them unconditionally without judging them, and just telling them that I am here for whatever you need, whatever you want to say. If you feel angry and you want to go on a rant, it's fine. I'm going to listen to you, and then how can I help you? Yeah.
Mm-hmm. And how effective are our response teams, suicide response teams, suicide hotlines in the country? Do they really work, and what hotlines are there to begin with even?
I think I'd say that the most effective one, I think I'd say it's the Red Cross hotline, 1199, if I'm not wrong. So maybe you could, if maybe it's a family member who's been told by someone, they could tell them to just call that number and speak to a mental health professional and see if maybe they could dispatch a team to go get them, if there's if now we are having curfew or not, or if the family member is far. So I think Red Cross 1199, and then I also think Befrienders Kenya. I think you could just go online and get their number. They could also offer some help. Yeah.
Okay. 1199, you said.
Yeah, Red Cross.
Okay. Dr. maybe any other hotlines in the country, or any other emergency response teams that if one is quite confused, they can probably call in for help?
Yeah, I would also say Mentor 360 for young people, and generally, it's good. You could contact any hospital and talk and ask to just talk to a counselor, in the facility. Probably even if it's not a hotline, because again we are saying that every hospital is a mental facility.
Dr. there was a Ministry of Health at one point had a hotline. Is it still available to the public, for the common mananchi who may not feel very comfortable calling maybe Red Cross. I think was it Madari or the Ministry of Health, or together?
I'm not aware of that hotline, but should I find it, I will tweet it. So you can follow me at Dr. Chitai and see if I get it, and I'll follow you back. But if I get it, I'll tweet. Yeah.
All right. So both of you just mentioned that. Sorry, we lost one of our panelists. For those who are joining us, she has a blackout, so her internet connection is not too good. So when it comes to, you said, both of you mentioned that we need to talk to the person and make them feel safe when you're talking to them. Don't be judgmental. At times when you're talking to someone, they tell you, don't tell anybody. What is your opinion about swearing to secrecy? Maybe you found them attempting suicide, and maybe this is your cousin, for example, and they tell you, don't tell mom, or don't tell who, so and so. What is the right way to go about it? Would you swear to secrecy? Would you not swear to secrecy? Daktari, you can take us on that one.
Yeah, so I think it's very important to respect that aspect of confidentiality for the discussions that you have with patients, and that is it's a very important we have to respect it, and personally I will respect it if that is the request of the patient. So the only time that I'll break confidentiality if the person poses a risk to somebody else. You know, if the person told me that they were planning to harm another person, so I'm responsible for telling the other person that your life may be in danger because of this. So those two maybe cannot be mixed, but on account of suicide, someone confiding in you about their suicidal feelings, I think that should be kept confidential as per their wish, and you can try to provide them help within that context of confidentiality.
Mm-hmm.
Yeah.
Adhiambo, in the context where probably it's not a patient this time, maybe it's someone close to you, and you have no doctor in the picture, you have no mental health specialist in the picture. Is it still the same to maintain that confidentiality?
I think what I'd say is, so that, because sometimes suicide could be maybe valid, like there's a rationale behind it, or sometimes it could even be due to psychosis, that you're getting like the command hallucinations and they're telling you to harm yourself, even to the point of suicide. So I'm thinking that it would be important for this person to get help, in as much as, yes, you do not want to breach confidentiality and you want to be in good books with this person. Maybe you could tell them that I'm okay with keeping your secret on condition that you get help. That maybe if there are underlying issues, either job loss, finances, or maybe a divorce, separation, and you've been thinking about that yes, I'd want you to seek help. It could, if there are no mental health professionals around, even religious, you could go to your pastor and talk about these things. Just someone who is, you consider of higher authority, who can offer solace or advice, or just a good listening ear. So you could tell them that, yes, I can keep your secret on condition that you get help.
Mm-hmm. Okay.
Yeah.
What happens in the case where now you're not really talking, you find them in the act of attempting suicide? Either they have tied a snooze and they're ready to hang on it, or they've bought all these medications and they're juggling them down, or whatever other method it is that they're using. How do you, as a lay person, you have no training in mental health first aid, how do you help them in that point in time, that exact moment? What do you do, or how can you respond to that?
So if you found them alive, interestingly, a lot of people express some form of relief if they attempted suicide and so it was not successful, as you use that term. They always show some form of relief. So at that point, most of them would actually be willing to now seek some help if that was not successful. And the priority at that point would be to maybe get some medical treatment for any injuries that might have occurred. If it was an overdose or of something, they go to an emergency, taking them to an emergency department for some medical treatment. And then thereafter, we can introduce counseling once this person is now out of danger.
Mm-hmm. Okay, Adhiambo?
I think I'd say the same thing, but like as you said, as attempt is considered a psychiatric emergency where that person needs to be taken to a hospital. So in case of an overdose, they go and maybe pump the meds out. Yeah, like Doc had said, if there are any injuries, they need to be taken care of, and also mental health support is supposed to be offered for all suicide attempts. Yeah.
So would you swear to see this situation?
As a lay person.
Yes. If you find someone in the act and they tell you, don't tell anyone, you didn't see anything, how do you go about it? Would you still swear to secrecy, or how do you go about it in this situation?
Can I jump in?
Yeah,
I think
sure.
I think, Linda, the thing is we are not lay people ourselves, but we want to communicate to people who may be listening to us who are themselves lay people without background training in mental health or medicine. I think the right thing to do is that this person would need help. All right. So I mean, at that point, the most important thing is you want to save their life. You want to get them some professional help. So the priority there will not be the secrecy, but to at least get them to a hospital, let them get some treatment for if it was poisoning and so on, get stabilized, and then undergo some mental health assessment. I think that's what, in my opinion, would be the right thing to do, rather than keeping it secret and so on. But I also think that that because of the law, sometimes people feel threatened by the law and the penal code that outlaws this, and in some areas where people are not well sensitized, like you may find people also getting harassed, if not by the community, sometimes by the state officers. And I think generally a lot of people are getting sensitized about it, even the police, that someone who has attempted suicide is not a criminal, they are unwell. And most of the times you'll find that the person could have an underlying mental condition, as it is known that a lot of suicidal, for most people with suicidal behavior, there's an underlying condition. Could be depression, could be substance use disorder, it could be anxiety, it could be psychosis or bipolar mood disorder. There is an underlying, for most cases, mental disorder. So this person needs some assessment and treatment. And when they have gone to the level of an attempt, it's an emergency. So they need to get to hospital as soon as possible. Yeah.
Okay. So it will not be wise to swear to secrecy at that point. Yeah. Okay.
Yeah.
Thank you for that. So you mentioned a very good thing there, the community, how the community treats someone once they have attempted suicide, including the authorities and everything. And we know that suicidal attempts are still illegal according to the Constitution, if I'm not wrong. Yes. So how do we treat them after? Now they have survived the attempt, they've gone to hospital, they've been detoxed of the medication that they had overdosed on. They're now okay, they've been discharged, they're probably on whatever the maybe psychiatric medications or any other medications they're on. How do we treat them now as family and friends? What is the best way now to treat them so that they don't feel stigmatized? Adhiambo?
I think I'd say just treat them as you did before, but now you need to be like more grounded and more present in their lives, because like Doc had said that over 90% of suicide cases, there's an underlying and manageable mental health condition. You know, that these are people who at that particular moment when they were attempting, they were not able to even vocalize or say what was going on. But at this point, they've gotten help and they've gotten the necessary mental health support. So they're just the normal human beings they were even before the attempt, only that now they're even in a better place. They're even more mentally aware of themselves and the issues, and even how to cope with the issues that they were not able to cope well with before. Yeah, so just treat them like normal human beings, because now the opposite would be to like be like a helicopter parent, you know, that you're just overpowering them, you're just too nice, too present, which could also be counterproductive. So yeah, just treat them normally and then tell them that, you know what, if you want to talk, I am here. I'm going to offer that listening ear, that shoulder to cry on, and I'm going to be more present, because now that incident was a wake-up call that maybe I was not as attentive as compared to before, but now I am here. So whatever you need, I am here for you. If you want to talk, I am here. If you feel like you need further professional help, I can facilitate it. And then it's also so sad that even some churches excommunicate members who've actually attempted suicide. You know, that is very wrong. It contributes to stigma. And even the question that you had asked before, the one about why we no longer say that the person committed suicide, because you commit a crime, you commit an offense, but suicide is not criminal. You know, sometimes it can feel rational, and it could be due to an underlying but manageable mental health condition where it's not an offense. So we say the person died by suicide, but they did not commit suicide. So even like the language we use, we need to be very aware and ensure that it does not further contribute to the stigma. Yeah.
Okay. Asante for that. Mrs. Koi Mushara, are you back? I can see you're back. Reply with yes, or don't reply. Okay, I don't think she's back. Okay, so we need to still be the same people we were around them without making them feel that we're treating them much different than we were before, right? Okay, thank you for that.
Can I chime in at that point? Yeah, I mean, you know, this person comes back, it will be difficult, and you have to go through the process of accepting them back, and it's not so easy. We should not make it appear like it's very easy. It will always be difficult, given also the stigma. Maybe the neighbors now know they are now discriminating the whole family because of that incident. So but one of the things is that also it's good to understand some of the factors that may have contributed, because there are always many risk factors, and suicide being very complex with genetic predisposition, with a person's character, the psychological factors, the social factors. Being male, for example, is a risk factor. You can't change that. Yeah. So the ratio is 3:1, male to female. You can't change. There's some that you can't change, like age, but there's some that you can modify. So things like conflicts within the family, we can find ways of resolving some of the conflicts in the family, maybe issues of joblessness, issues that may have caused them pain to get to that level. Also, it's good to encourage them to simply get connected. A person who is connected to other people, to other interests in life, hobbies, is less likely to develop strong suicidal behavior. Yeah.
Okay, and you've mentioned a lot of risk factors, Daktari. I think a question a lot of people keep asking is, what can push someone who's he's an elite person in the community? They seem to have their life going on. They have a good job. They have a good family. They have, basically, from an outsider's point of view, they seem to have it all going on. But then they get to that point. What are some of the reasons that could lead to that? And they're not known to, or rather the community doesn't seem to know that they have any obvious mental illness. Adhiambo, maybe you can help us with that. I don't know, we also lost Daktari. I don't know what's the internet is going with the weather.
I think I could start off where he had said, for example, age being, not age, sorry, gender being a risk factor. So like the ratio 3:1, that is male to female. And then also age between 18 and 18 and 35, I think within that age range, they are more predisposed. If there's family history of suicide, then the person is at risk. If there's family history of mental illness, that is when that's the role of genetics in that. And then if the person is dealing with addiction issues, it could either be gambling or addiction to drugs or substances and alcohol. That could also be a predisposing factor. Recent job loss, separation or divorce are also risk factors. What else? Yeah, I think I could start with those ones, and then maybe since Dr. is back, he could continue as I think of other risk factors. But also, yeah, underlying mental illness could be a risk factor to suicide. Also self-harm behavior. Yeah.
Yes, sorry, I'm back now. I went through some disconnection. What was the question?
A person who seems to have it all figured out. It's going very well for them in life. They have to the common man or to an outsider, there's nothing wrong with their life. People even envy them, and then one day you just wake up to the news that that person is no more. What are some of the things that could push people to such levels?
Yes, it can be very confusing, in that regard. And we have to know that there are many theories that people have tried to come up with to explain why suicidal behavior happens and why people develop these behaviors. Because generally, our intention is to live. Human beings have this strong intention to live. Yeah, however, over time, people have really thought about the question of suicide. And by the way, I think suicidal behavior is only a human behavior. It's not found in animals. And probably it's because of how well developed our brain is, and the idea that our brain is the most complex, and we ask a lot of questions about our lives. So one of the earliest theory was social, that suicide maybe happens because of disturbed social factors, maybe breakdown of family, excommunication from the society, you lose your belonging to the society, such factors. But also that these factors about people questioning the meaning of life. So a person whose everything is going so well with them could go into a search for what does really life mean? Why are we here? And what is the purpose of this? And sometimes when you ask such questions, you come to a conclusion that life is meaningless. So if you come to a conclusion that life is meaningless, then that also can drive you towards suicide. However, the best theory about suicidal behavior is one that has to do with someone who is encountering some pain. So a person could probably be going through pain that is unseen by others, because it's not always possible. So going through pain that is unseen by others, accompanied by a sense of hopelessness, and this person could also be quite isolated in a way. They're not connected to a lot, and so on. And then there's the genetic aspect to it. So the individual also probably has a genetic predisposition whereby their experience of pain is different. So people who resist pain or who are insensitive to pain have a higher risk of suicide. So they could have all these factors that we do not know. And then also looking at maybe their prior knowledge about these suicidal methods. Doctors have prior knowledge about poisons. Military people have prior knowledge about use of weapons, and so on. And so this prior knowledge about these risk factors or these methods of suicide is also an added risk. So it's good for people to constantly also evaluate themselves about their risk factors. And but it's all possible, and it's because of the complexity of the whole suicidal behavior that leads to it. But basically, pain, hopelessness, lack of connectedness, and knowing or access to a means, for me, are the crucial things that could easily contribute to a person's suicidal behavior and maybe the unfortunate case of suicide.
Mm-hmm. Okay, thank you for that comprehensive answer. Before we go to the audience and the questions from the audience, just one last question for you, Adhiambo. If you lose someone to suicide, a friend, a relative, a parent, a child to suicide, how do you heal from that? Because you already know grieving itself is a very complicated, it's a very difficult time. It's when it comes to suicide, there's now the complication now of one, the guilt, where some people may feel they were probably not, they probably didn't do their best, or they could have been better, maybe a better sister, a better brother to this person, and then there is also the aspect of the stigma, as Dr. Chitai said, that the family is now looking at you like this family of suicidal people. How do people heal, or what is the thing people should watch out for when they're healing from a suicidal death?
Yeah. I could start by saying that survivors of suicide, or even their family and friends, they're actually at risk of actually developing other mental illness, like for example PTSD. Yeah, that they're at risk of developing things like depression, complicated grief. So I'd start by, if you're able to, or if you can, you get proper mental health support, or even just join a support group. And with issues of stigma, sometimes even the family might actually not be, or they might be reluctant to disclose the nature of the death of a person. For example, if they found them hanging, they might say that maybe the person died after a short illness. So now the fact that they're not able to freely talk about the nature of the death, that could also complicate the grieving process. Because now with grief, when psychoeducating my clients, I'd liken grief to like a wound. You know that when it's fresh, a deep wound, that when it's fresh, it is intense, it is painful, but eventually it heals, and you remain with a scar that will be a constant reminder that something significant happened, but now it's not as tender as before, and it's not as painful as before. So the first thing would be to acknowledge the pain. That yes, you have gone through a loss and it's painful, so acknowledge it. Do not try to minimize, suppress it, or completely ignore it, or indulge in things like drinking alcohol or taking substances as a means to just avoid dealing with it. So yes, deal with it, allow the pain to come in, acknowledge that you're feeling hurt, that you're feeling guilty, that maybe there are things you could have seen, or maybe there are signs that you could have missed. Now you feel that you're probably not the best person, but yeah, accept that this is your situation, that you have gone through the loss. So what can you do to get through it, not to get over it? You're getting through the grief. So allow the pain to sit in. If you feel like it's complicated and you're heading towards depression, the difference between grief and depression is that with grief, you can have brief moments where you're happy, but with depression, you're just low completely. So also be wary, so that if it's depression, get proper mental health support from a professional who will screen, then offer appropriate interventions for that. If it's still grief, yeah, just remember that it is a wound, and a wound takes time to heal. Sometimes it could get infected, so now that is complicated grief. And when it gets infected, it means that you need help. So you could go get, if it's a wound, you get antibiotics, or yeah, you go get drained like the past and something. So in this case, you go get professional help if it gets complicated. But at some point, we're going to be left with a scar. So yeah, get social support, talk to people about it, create awareness. Also, like with the siblings or parents, you can just sit, have a family meeting and talk about how you've been feeling, how the loss has affected you, and what you can do together as a family to move forward. Yeah.
Okay. Right. So